Hello, and thanks for joining us. I'm Brynne McBride of ABC for Health, and today we're talking about Medicaid per capita caps, Medicaid spending limits. It's a proposal that's being tossed around as an alternative to the way that Medicaid runs right now. We thought we'd take a closer look at what that actually means. But we'll first start by refreshing our memory on how Medicaid works right now. Medicaid covers 73 million people as their main source of health insurance, public health insurance. It's largely for low-income folks or folks that have disabilities. It is the principal source of long-term care coverage for many Americans. Medicaid reimburses providers, hospitals, community health centers, nursing homes for the care that is administered, and the Medicaid program actually finances about 16% of all personal health care spending in the United States right now. It is a federal-state partnership. There are federal standards that are established, and states have flexibility to administer and design their own programs. The funding is shared. The federal government matches state Medicaid spending, and this is on an open-ended basis. Now, proposals that have come around to try to restrict costs and restrict how much the Medicaid program is spending have tried to adjust this feature of the Medicaid program first. Get rid of that open-ended basis language and start putting some limits, and that's where per capita caps comes from. It's a cost containment and cost control proposal. This is not the new way of Medicaid. This is what's being discussed right now as one of the options. You may have also heard about Medicaid block grants as an option for reformatting how Medicaid is administered and paid for. We have a separate video case tip on Medicaid block grants. Let's take another look at per capita caps. It scales back the federal contribution to states, and it actually sets an upper limit on the federal spending per Medicaid enrollee. It allows funding to increase as enrollment increases, which is different than how Medicaid block grants are being proposed. Medicaid block grant says, here's the set number of dollars for your state to divvy up any way you see fit. Per capita caps does take into account the number of enrollees your state has. It's a little bit more flexible, and it has gained a little bit more favor because of that flexibility. Now, there are different ways of administering per capita caps. The federal government could set a single per enrollee cap that applies to anybody enrolled in Medicaid, regardless if they're children, elderly, those with long-term care needs, or those with disabilities. That hasn't won a lot of favor over time. It does keep the per capita caps much lower. Children are very cheap to insure as compared to folks that are a little bit older. If you set a limit, it's usually going to be a little bit closer to the low end, which means the states would then be responsible for making up the difference. The other way to administer this is to set a cap for each group, set a per capita cap for children, set one for folks with disabilities, set one for elderly. Or you could exempt groups from the cap. You could say this is the per capita cap for your state, except for people that have disabilities, they're exempt from that cap. There are different models and different proposals. There are shortcomings as well. Under caps, as well as under block grants, states face a gap between the cost of providing coverage and the federal funds available to offset those costs. It's the very design of a per capita cap is to reduce the federal contribution. The effects of a per capita cap could have consequences, therefore, on people's care. It also has an impact on providers. States could, in essence, reduce how much they compensate providers for providing services to Medicaid enrollees. They could reduce managed care payments, and some experts have said this would throw the managed care plans into chaos and might even be their demise. They could also narrow eligibility to cost controls, maybe even eliminate coverage for the most needy. A more extreme example, but you could certainly see where reducing the number of eligibility criteria could come into play. You could actually prevent people from getting into the Medicaid program. The modern examples of proposals for per capita caps remove Medicaid as an entitlement. They say it's no longer an entitlement. These are the people that they could come in until the cap is met, and then we could no longer serve you. Per capita caps are not new proposals. These have been around for a long time as an alternative to the existing Medicaid entitlement program. It's also come from both sides of the political aisle, which a lot of people forget about. It was in 1997 that then President Clinton introduced per capita caps as a way to reduce federal spending on Medicaid. The difference, he left Medicaid as an entitlement in his proposal. The critique of that came from the states and from the Governors Association and from a lot of Republicans was that shifts too much of the cost to the state. It reduces the federal contribution, but it leaves the states on the hook to make up for all of the extra costs because it was an entitlement. That proposal failed, and ultimately what happened as a cost savings measure was reduced payments, reduced dish payments, and states ended up making up some of the difference anyway. That was in an era where only 37 million people were enrolled in Medicaid. Today we have twice as many people enrolled in Medicaid, largely thanks to the Medicaid expansion. You can see if we were to get rid of Medicaid as an entitlement and get rid of Medicaid expansion, you might see a great reduction in the number of people eligible for Medicaid and more proposals like Medicaid block grants and per capita caps coming. These proposals are going hand in hand with proposals to repeal the Affordable Care Act and things like a Medicaid expansion for a lot of states. That kind of talk is getting a lot of heat and a lot of discussion, and we share with you here a couple of those articles that are talking in more detail about all of those topics. You can click on that information button that you see at the bottom of your screen to read those sources, but also to share your story. What does the ACA or Medicaid expansion or Medicaid right now mean for you or your family? You can also share your story by visiting our website at healthwatchwisconsin.org. Thanks for joining us.